Buckle up, and if you have MCAS and want to know how I got diagnosed, stick around to the end. This is going to be the full 3 minutes. How did I get diagnosed with MCAS? I've talked about how it took 15 years to get diagnosed. If you're curious, I do have a worst MCAS reactions pinned post on my TikTok. If you're seeing this on YouTube, Facebook, or Instagram. Now, I've been diagnosed without actual testing. Testing was done multiple times, but what you need to know is that the gold standard for a lot of doctors is tryptase testing. And tryptase is just one of the mediators that is released during a reaction, and it has to be caught within a certain time. The problem is for a lot of us is that it usually needs to be caught right after a flare, which is extremely difficult to get. I had one doctor suggest I actually trigger a flare and hang out in the hospital parking lot. Never went back to that doctor. Understand that the majority of mast cell activation patients do not show elevated tryptase levels, at least to outside of the standard norms. And if that's the only mediator that a doctor is going to test, which mine did multiple times, and my test always came back normal, then there's a chance that you're not going to get the diagnosis that you need from that particular doctor. So my first question when I was looking for new doctors after the first experience with the allergist who tested me 4 times and said, stop bothering, stop asking, handed me an EpiPen, all of the mast cell mediators, and told me she wasn't going to diagnose me with MCAS, was, are you MCAS aware? And do you also look outside of tryptase testing and also look at clinical presentation, history of symptoms, and patient response to standard MCAS stabilizing protocols like low histamine diet and mast cell stabilizing medications? It took 15 years, lots of medical gaslighting, lots of tears, lots of frustration, and a lot of doubting my own reality, and enough medical trauma for an entire book. But I was officially diagnosed by a nurse practitioner in around October of 2022. Know that also any MCAS aware practitioner can diagnose you with mast cell. It does not need to be a particular specialist in a particular branch of medicine. I hope this helps. Please stay safe. I know how difficult it is to get an MCAS diagnosis, and I know that a lot of doctors are hesitant to give one.